Welcome to our channel. Today, let's talk about diabetes. Nick Jonas, diagnosed with type 1 diabetes at just 13, has shared how he constantly monitors his blood sugar levels, even while on stage performing. Tom Hanks revealed his type 2 diabetes diagnosis in 2013 and has spoken about how it requires him to maintain a strict diet and exercise routine to manage his health. Meanwhile, Vanessa Williams, who lives with type 1 diabetes, has opened up about the emotional toll it takes on her, especially during busy work schedules when she has to juggle her health needs with career demands. These celebrities illustrate the daily struggles of managing diabetes, which can affect everything from their diet and fitness to their mental health. So, what kind of demon is diabetes that it wreaks such havoc on our lives? And how can we actively manage it once we're diagnosed? Today, we'll be discussing this very topic. Everyone, welcome to MedFun, a channel dedicated to sharing medical knowledge in an engaging and informative way. Over time, the number of people diagnosed with diabetes is rising, and it's affecting younger and younger people. Let's have a look at some US numbers. The CDC estimates about 96 million pre-diabetics, which is an astonishing amount when we consider this is about 1/3 of the population. Around 20 million are on oral treatment, and another 10 million are on insulin, about half of whom are taking both basal and bolus insulin. The earliest records show that 2 Indian doctors noticed that ants were particularly attracted to the urine of people with diabetes, which made them suspect it contained sugar. Then in the 17th century, a British scientist evaporated the urine of diabetic patients and confirmed that it did, in fact, contain sugar. But why does sugar appear in the urine in the first place? To understand this, let's first explore the mechanism of diabetes. Imagine your body as a large factory with many workshops, and each workshop represents one of your body's cells. Just like any factory, fuel is needed to keep everything running smoothly. In your body, this fuel is called glucose, or sugar, which comes from the food you eat. But the workshops can't access this fuel on their own. They need special workers with passes to deliver the fuel to each workshop. These workers represent insulin, a hormone produced by your pancreas. In a healthy body, everything runs smoothly. The workers deliver the fuel to the workshops, and the factory keeps running efficiently. However, in people with diabetes, this system doesn't work properly. There are 2 main problems that can occur. A. Impaired pancreatic beta cell function, type 1 diabetes. Pancreatic beta cell function produces insulin, or workers with passes in our analogy. The body doesn't produce enough insulin, which means there aren't enough workers with passes to let the glucose into the cells. As a result, the glucose stays in the bloodstream, and the cells don't get the energy they need. Blood sugar is elevated, but the cells are starved for energy. B. Insulin resistance, type 2 diabetes. The body still produces insulin, but the cells become resistant to it. It's as if the workshop doors are broken and won't open, even with the passes. Again, the glucose can't get into the cells and stays in the bloodstream, leading to high blood sugar levels. So why does glucose end up in the urine? Here we need to learn how urine is formed in the first place. Simply put, as blood flows through the kidneys, they filter and reabsorb useful substances, including glucose, pulling some of it back into the bloodstream. The leftover waste and excess water then become urine. So, basically, urine is like filtered blood. Now, coming back to high blood sugar. When blood with too much glucose flows through the kidneys, they can't reabsorb all the glucose. The excess glucose ends up being passed out in the urine. That's why there's sugar in the urine. Over time, this buildup of glucose in the bloodstream can cause serious health problems, as the cells are starved for energy while the sugar accumulates in the blood. Here I have summarized the comparison between type 1 and type 2 diabetes. Now that we understand the mechanism of diabetes, what kind of harm does it actually cause? Next, we'll talk about the clinical symptoms of diabetes. In short, it can lead to weight loss and constant thirst, often summarized as 3 highs and 1 low. Increased thirst, increased hunger, increased urination, and weight loss. But why does this happen? As we mentioned earlier, when blood sugar stays high, the kidneys can't reabsorb all the glucose and have to let it go. But as the glucose leaves, it pulls water along with it due to osmotic pressure. More water means more urine. And when you're urinating more, your body loses water, making you thirsty, hence, you drink more. With glucose being excreted in your urine, Your body isn't getting the energy it needs, so you end up eating more. But even with all that food, your cells still can't efficiently use the glucose. So, the body starts breaking down fat and muscle for energy, leading to weight loss and fatigue. That's the reason for the 3 highs and 1 low. This reminds me of when I was really into fitness. Everything I bought had to be top of the line. I even got myself a massive 5-liter gym water bottle. One day, I took it with me to class, planning to hit the gym right after. But for some reason, I was incredibly thirsty that day. So, I pulled out the bottle in the middle of class and started chugging. I drank half the bottle right in front of the teacher. The teacher just stared at me, completely shocked. I was confused, too, but I didn't stop. I just kept drinking with the bottle practically hanging from my mouth. Then the teacher paused and pointed at me, saying, "This is exactly what a typical diabetes patient looks like, drinking that much water." I realized he was just talking about diabetes at that moment. Now, if the 3 highs and 1 low aren't treated in time, they can lead to diabetic kidney disease and cardiovascular problems. The kidneys are overworked, and there's too much glucose in the blood vessels. These are actually some of the most common causes of death in people with type 1 and type 2 diabetes. So, is diabetes scary or what? But even scarier are its complications, like diabetic ketoacidosis, DKA, hyperosmolar hyperglycemic state, HHS, itchy skin, retinal macular degeneration, and diabetic foot. These complications can seriously affect quality of life and, if untreated, can be life-threatening. Now that we've discussed the clinical symptoms of diabetes, it's important to note that many people don't show symptoms in the early stages of the disease. So how can you determine if you have diabetes? Next, we'll talk about diabetes testing. There are several methods for testing diabetes, including urine glucose testing, genetic testing, glycated hemoglobin, HbA1c tests, and glycated plasma protein tests. However, the most common method is the oral glucose tolerance test, OGTT. For this test, patients need to fast for 8 hours without any calorie intake. In the morning, a fasting blood glucose level is measured, and then the adult patient drinks a solution of 75 grams of glucose dissolved in 300 milliliters of warm water. Blood sugar levels are then tested at intervals of 30 minutes, 60 minutes, 120 minutes, and 180 minutes. This is the most comprehensive OGTT available. If the fasting blood glucose is greater than or equal to 7.0 millimoles per liter, or the 2-hour blood glucose after the OGTT is greater than or equal to 11.1 millimoles per liter, this indicates a possibility of diabetes. I've prepared a table that outlines the different conditions in detail for your reference. Even after undergoing an OGTT, there's still a small portion of patients whose blood sugar levels don't change. This condition is known as latent diabetes, and we need to consider another important factor: high-risk populations. When it comes to diabetes, especially type 2 diabetes, here are some key points to see if you fall into a high-risk category. Age over 40, history of abnormal glucose tolerance, overweight with a BMI of 24 kilograms per square meter or higher, sedentary lifestyle, family history of diabetes in first-degree relatives, low blood pressure of 90 millimeters of mercury or higher, and high blood pressure of 140 millimeters of mercury or higher. All these factors place you in a high-risk group. Now that we understand the potential risks of diabetes, what should high-risk viewers do? What treatment should they have? Insulin injections. You've probably seen this before. You have the whole syringe and then bam, a quick jab. Some people inject into their stomach, others into their arms or thighs. Different injection sites correspond to different absorption rates, and you have to switch up the spots regularly. Talk about a hassle. This type of treatment is generally used for type 1 diabetes because they have fewer insulin delivery workers, beta cell. Let me give you a little quiz. If you have one person who injects 10 units of insulin at a time and another who injects 40 units, which one is type 1 and which one is type 2? The person injecting 40 units is likely type 2. Why? Because type 2 diabetes is associated with insulin resistance. Injecting 40 units doesn't necessarily mean that much insulin is effective. So, type 2 diabetics typically don't rely on insulin injections. If they do, it usually means their condition has become quite serious. Oral hypoglycemic agents, metformin and acarbose, are classic oral medications for diabetes. but they work in different ways. Metformin primarily reduces hepatic glucose output, decreases glucose absorption in the intestines, and helps increase insulin sensitivity. It's used to treat insulin resistance, so when glucose can be effectively taken up by the cells, high blood sugar is resolved. Acarbose works on a more complex principle. When we eat foods like rice or starchy foods, our body needs to break down polysaccharides into glucose. However, in diabetes patients, insulin isn't as effective at this process, meaning they can't transport the glucose well. Acarbose slows down the breakdown of polysaccharides, allowing insulin to catch up and manage the glucose levels more gradually. This way, blood sugar rises slowly, which also helps address high blood sugar. There's also a newer treatment called dapagliflozin, which works by helping the body excrete glucose through urine to lower blood sugar levels. All of these medications are prescription drugs and can have certain side effects, so they must be used under clinical guidance. Exercise and nutritional therapy. Although diabetes patients are getting younger, the good news is that most are still in the early stages or have mild symptoms. This makes exercise and nutritional therapy essential. Here's a suggestion. Exercise should be moderate and appropriate. Avoid any intense physical activity. Aim for about 150 minutes of exercise per week, broken down into 5 sessions of 30 minutes each. Activities like jogging at a moderate pace or playing badminton or pickleball are great. You can adjust the amount of exercise based on your personal circumstances. Now, regarding nutritional therapy, it's recommended that daily fat intake should not exceed 30%, carbohydrates should be around 50%, and protein should make up 10% to 15% of your diet. Additionally, salt intake should be limited to under 6 grams per day. It's also important to include various trace nutrients in your diet. If you're overweight, losing about 5% of your body weight over 3 to 6 months is ideal. Let's chat a bit more. Why are there so many diabetes and suspected diabetes patients nowadays? It's either because people are living too comfortably, indulging in food and drink without moderation, or due to the fast pace and increasing stress of modern society. Many individuals are gradually losing themselves among the piles of folders on their computer desktops, neglecting the balance between work, study, and life. Achievements in careers and academic progress bring unparalleled pride, but life isn't just about one project or one success. What truly sustains long-term happiness is a healthy body, and only you can be responsible for your health. Lastly, I want to say a word to those who have been diagnosed with diabetes. While it's not easy to treat, viewing blood sugar control as a reminder to maintain a healthy lifestyle can be empowering. It's like giving yourself another chance to live a disciplined life. Next time, I'll create more videos focused on blood sugar control, which will be beneficial for both healthy individuals and diabetes patients. Remember to like, follow, and leave comments. Thank you all for your support.